is Sahu, practicing in Cuttack since 1974. It's about 48 years of practice that I have been doing, and then therefore we usually see a lot of patients. And then on this auspicious week of the World Hypertension Week or World Hypertension Day, since that started since day for yesterday, we have been doing activities. And then there are a lot of patients that comes to us with no symptoms. There are some patients those who come with a lot of symptoms like giddiness, headache, and insomnia, with the family history or without the family history of hypertension, but still we have to check their blood pressure regularly. You know, whenever I see my patients, I usually tell them that there are few things that we have to take into consideration. Your weight, BMI, body mass index, which should be within 25, but there are a lot of patients those who come to me with BMI more than 25, but sometimes it's 25 to 29 or even more than 30. To those, I usually say that, okay, you have to reduce the weight. And the physical activity is the most important thing. There are a lot of advices that we have to give. Besides the medication and other things, we have to do some of the investigations. And the routine exam investigations have to be done. They have to be compliance with the treatment that they're taking up. And it is not only the individual patient that comes to us, it's important, but also their relatives, those who come accompany the patients, is also important for us, because supposing if I check only the patient and then leave him, then the relatives or the attendants, those who come accompany the patients, have to be educated, and those education has to be given to the patients and advice, and then advices to be given to them, so that they will take care of the patients. Sometimes the patients that take care of themselves, but it's more important that the family also takes care of the patients. So it is the family which is important for them, and also not only the near dear families, but also the extended families. And also it is important to have a follow-up. The follow-up of the patients is more important. Therefore, whenever we see any patients, we have to ask them or advise them that they'll have to come with their papers, with the investigations, and also the follow-up whenever they are given follow-up time or date is given, so they don't need to be followed up. More important is that hypertension has become a pandemic nowadays. It's more than a problem rather than as a burden, because India has become the largest or the most populous country in the world, even bypassing China. And as we see the population, it's our responsibility as a citizen of India that we have to check that how these people, they are suffering from hypertension and diabetes. But hypertension again is, if we consider the number, then demography, if we say that, prevalence also, if we see that, as the urban and rural population that comes to us, but in the urban population, the prevalence rate is little more, like more than 30, and in rural population, it is almost 27 to 29. But when we consider about the patients or the people at large, India has become the hypertensive capital of the world. And therefore, it is our responsibility of, as an Indian, we have to see that our Indian people, they are much comfortable with the patient, with the treatment, and also the awareness that we have to create in them. And therefore, the awareness creation is not only the responsibility of the doctors, the cardiologists, or the medicine specialists, but also it has to go to the grassroots level. And then grassroots level, what I mean is that all the Ayush doctors also have to be treated, have to be engaged, have to be trained to check the blood pressure properly and check it correctly, and also with a good instruments. And therefore, it is not only that doctors also fraternity, whether it's allopathic doctor, the Western doctors, or the allopathic or the homeopathic doctors, or the Ayurvedic doctors, but also the Ayush doctors, those who are engaged now in the mainstream of the central government scheme. So these are the people, those who have to uh, uh, be oriented and educated and trained properly to check the blood pressure. And also, even we consider that the hypertension is a pandemic now. We have already told that, and India has become a hypertensive capital of the world, and therefore if we want to keep our India healthy, then the prevention of hypertension also is an important thing. That by that uh, it can only be possible through the awareness, creation of awareness. And how this awareness can be created? It is not only by the doctors only, it is also the social, international social organizations like Rotary Club, like Lions Club, like YMCA, like Wiseman Club of different parts of India. These are the all the social organizations have to join hands to the with the doctors and then also the medical fraternity to create an awareness amongst the people as to how they will take care of their hypertensive patients. So prevention also is an important thing, and then prevention also only can be done by the awareness creation. So most important message that I would like to say is that create an awareness amongst the people, and also if the patient is having hypertension, they should be treated uh, intelligently and also legibly, and also the patient should adhere to the patient. The adherence of the patients to the treatment is important, and the regular follow-up also has to be done. So these are the few tips that I would like to say, that yes, less of it's not only the medicines which will help, but also the lifestyle modification is more important. So it is the lifestyle that we see nowadays with the younger generation, obese children or obese adolescent or obese youth, that has become a problem to the society, and therefore we have to prevent these or the treat that obesity, and also prevent the disease, hypertension, and also diabetes. Thank you very much for the patient hearing.